Hello people, in this video we want to address the causes of ectopic pregnancy, why ectopic pregnancy occurs. Okay, so that is what we are trying to address. In the previous video we have looked at what ectopic pregnancy is, where the fertilized ovum is implanted and it develops outside the normal endometrial cavity. That means the fundus, the body of the uterus, etc. Okay, so it can still be within the uterus, but it can still be called as ectopic, right? So the sites of ectopic pregnancy you have seen in the previous video. It can be extrauterine, which is most common, is the fallopian tube, tubal pregnancy, and then it can be in near the ovary, ovarian, and then abdominal. Then in the uterus itself, it can be in the cervix, angle that is near the ostium, which is opening towards the fallopian tube, cornua, the rudimentary horn of a bicornuate uterus, and then cesarean section scar, lower segment, hopefully. So basically, these are the sites of ectopic pregnancy. We have looked at these in the previous video. What do we want to look at in this video, guys? We want to look at the causes, that is the etiology of tubal pregnancy, basically ectopic pregnancy you can say. Mostly tubal they are talking about. Why are ectopic pregnancies happening? And mainly you should understand the ectopic pregnancies are increasing in number. The number of ectopic pregnancies are increasing. So you can understand why it is increasing, because there is more of STIs, that is sexually transmitted infections, are becoming more. First let's go there. See, look at this. Why there is rising incidence of ectopic pregnancies? First of all, let's understand this, because there is an incidence of infections being more. So what happens if infections are more? Ectopic pregnancies, right? Salpingitis, etc. will happen. Pelvic inflammatory diseases. There is an increase in ART procedures. That is, there is artificial reproductive techniques are more. Right now, people want IVF, or they want so many procedures are being done. Right? Assisted reproductive facilities. That is, if they are not able to conceive, they would have gone through some tubal patency and all. They will check. If there is some salpingitis, they'll try to resolve it. Or a lot of fixes happen, right? So that is why the ectopic also increases. Increased tubal surgery, like we told you, they're working on the tube. So what happens when they are working on the tube for whatever reason? Then this tube will become in such a way that it will attract the oocyte, the fertilized ovum, and it will implant and develop in the tube. So basically, these people have had a sterilization, not sure why in sterilization or a tubectomy it should happen, but a tuboplasty, right? What is tuboplasty? You're fixing the tube. Yeah, so you're fixing the tube. That is another thing. Or early detection of cases that were otherwise destined to undergo spontaneous absorption. See, what will happen in this case, sometimes if the the fertilized ovum is implanted here and developing here, after some time it can get spontaneously absorbed, right? It can get spontaneously absorbed. But now what is happening, people are going in early for early scans, etc. And they are able to detect this ectopic pregnancy much before than before. So what is happening is that will also add to this increase in the incidence of ectopic pregnancy. So now did you understand, guys, why ectopic pregnancies are increasing? Can you say why ectopic pregnancies are increasing? Because people are going for artificial reproductive techniques, yes. Assisted reproductive techniques. They're having surgeries on their tube. They are having STI sort of infections. They're having salpingitis, and they are also going for ultrasound scans very early in the pregnancy. So ectopics are being detected more than before. So earlier, if it goes into spontaneous abortion, they might have even not known that it was there. But you should understand that an ectopic pregnancy is a life-threatening situation for the mother and obviously the fetus. But the mother if the ectopic pregnancy ruptures, it will be dangerous for her. So please focus here, ectopic pregnancy. Be careful, okay? So who are the people who are having high risk to ectopic pregnancy? They had some pelvic inflammatory disease, some sexually transmitted infection, or any infection of the uterus and the tubes, etc. If they've had a tubal ligation, what do you mean by a tubal ligation? They have tied the tube, kind of a thing. So is that same as a tubectomy? Tubal ligation. Then contraception failure, like we told you, if they have a IUCD, intrauterine contraceptive device which has failed, then there can be a ectopic pregnancy. If they've had a previous ectopic pregnancy, then they can have an ectopic pregnancy. If they've had a tubal reconstructive surgery, so their tubes were not proper, they've had a tuboplasty, then because of this reconstruction, let us say the oocyte stays there, or it's not able to move forward, and there can be an ectopic pregnancy. History of infertility, that means to say they would have taken an assisted reproductive technique if they are taking, right? So what will happen, the tube is patent, especially the tube is patent, they are saying, but it is damaged. So what will happen, there can be an implantation and development of the fertilized ovum here. IUD use, what is this? What is IUD? Intrauterine device of use. Then previous induced abortion, if there has been an induced abortion, guys, if there has been an induced abortion, tubal endometriosis, that is the endometrial tissue is being found outside the uterine cavity. In this case, in the tube, you have the endometrial tissue, that will become tubal endometriosis. So all these are the risk factors for ectopic pregnancy. So look at the sites of ectopic pregnancy. You know the abnormal sites. You know it in the uterus and outside the uterus. Outside the uterus, where and all it can be in the fallopian tube, ovary and abdomen. Tubal, that is the fallopian tube ectopic pregnancy is the most common, right? So why is it most common here, guys, in the tube? Because first of all, let us understand the pathway, right? Where is the oocyte coming from? From the ovary, right? The oocyte is coming from the ovary. Then it is coming, the fimbria are picking up infundibulum, ampulla, isthmus, interstitial, they are saying, right? Interstitial. So basically the oocyte is supposed to travel like this. Where is it supposed to meet the sperm and undergo fertilization? The sperm is supposed to come here and fertilize the oocyte here, right? This is the normal ampulla. So you can understand now why tubal pregnancy is common, because it is the pathway, isn't it? It's pathway. And there can be, here actually there are cilia. Okay, there are cilia here, which help the, there are cilia here, are you able to see? I'm trying to draw cilia here. The cilia will beat, right? The beating cilia will try to push the oocyte into the uterus. But if there is some problem with these cilia, which are hair-like structures, if there are problem, then it will again stay here. And the ectopic pregnancy, tubal ectopic pregnancy can happen. So basically, are you understanding why tubal pregnancy is more, right? So basically, when the oocyte is coming, coming all the way, the oocyte will have something around it. Let's say this is the, let us say this is the oocyte, wait. This is the oocyte, okay, around it there is something called zona pellucida. Okay, I'm drawing here, zona pellucida. So what happened, there is early degeneration of this zona pellucida. So now you can see the oocyte how it is. So there will be early resumption of the trophoblastic activity because of this premature degeneration of the zona pellucida. So around the oocyte, what did you have? Zona pellucida. Can you say zona?
Zona
Pellucida.
pellucida.
Yeah. So there will be degeneration of the zona pellucida and a premature degeneration, and because of it there will be trophoblastic activity, and it will go and land up implanting much before where it had to implant. Then what is the other thing? Increased decidual reaction. What is decidua? Decidua is nothing but the pregnant endometrium is called decidua. So increased decidual reaction. Okay, so there is some increased reaction of the endometrium. Tubal endometriosis means what? The endometrial tissue is found outside of the uterus, that is in the tube. So where are you finding the endometrium? In the, say in the tube. In the tube.
In the tube.
What are you seeing? Endometrium. Endometrium.
Metrium.
Yeah. So these are some these are some factors which facilitate the nidation in the tube. That means the nidus formation in the tube. So why tube? You are understanding, right? So now let us come to the tubal pregnancy etiology. Basically, salpingitis, inflammatory pelvic inflammatory disease. That means these people have some inflammation of the tube. So because of this, what will happen? There will be this loss of cilia, like we told you. Okay, this will lead to loss of cilia, which are supposed to help the oocyte to move towards the uterus, right? So loss of cilia of the lining epithelium and impairment of this peristalsis, muscular peristalsis. Narrowing of the tubal lumen. So, tube lumen is narrow. Because of all this infection, it can happen that there is narrowing of the tube. Formation of pockets due to adhesions between mucosal folds. Pockets are there. So, it will go and sit in the pocket, looks like. So basically adhesions is the word I want to use. Then peritubal adhesions resulting in kinking and angulation of the tube. So the tube, instead of being like this, I try to draw a nice tube, but instead of being like this, the tube has become like this. Kinking and angulation of the tube, right? So this can happen. So I will say tube is not straight. Tube is not so straight. What do you say? It's more curved, etc. So what are the infections? Chlamydia trachomatis infection is the most common risk. So please write here, which infection are they really concerned about? Chlamydia trachomatis. This is actually there even in eyes, right? Eyes, I mean, it can affect the eyes. What is it? What is the thing? Trachoma. It causes trachoma, is it? Yeah. Now, after the salpingitis and pelvic inflammatory disease, the next thing they are talking about, everything they are saying is iatrogenic. So, it is very strange, blaming the doctor, or not blame the doctor, because of some procedure done on the patient. Iatrogenic, okay. So, what are these iatrogenic? The contraception failure means what? So, they have been using some form of contraception, and I mean, they should not even get pregnant, isn't it? But in selected contraceptive failure, there can be ectopic. Which contraceptive failure? IUD, that is intrauterine device. Okay, so if you are using copper T, etc. See, understand one thing. The whole purpose of the IUD was to stop the pregnancy. But if pregnancy occurs, then it will be a tubal pregnancy. So it is bad if it occurs, right? With this, the IUCD. So basically, what are they talking about? Especially with progestasert, there is more chance, okay? There is less chance with copper T, 380A and levonorgestrel devices, but with progestasert, it can be more chances, okay? Then, coming to sterilization operation. So basically, look at this. This person wanted a tubectomy, okay? But there is still a chance that they can have a ectopic pregnancy, is it? Because of sterilization operation failure, you can say. So, especially if they are having laparoscopic bipolar coagulation. If they've had a laparoscopic bipolar coagulation as a sterilization operation, then there can be failure and that can lead to tubal pregnancy. Then, use of progestin-only pill. So, obviously, you know that if people cannot take estrogen, then they will give them, instead of a combined oral contraceptive pill, they will give a progestin-only pill. If you are taking only progestin pill, what will happen? There can be increased chance of tubal pregnancy due to impaired tubal motility. Okay. So, basically, understand guys, what are we talking about? We are talking about only the contraceptive failure, under which there are 3 points, okay. Also, if they are taking a postcoital pill, postcoital estrogen preparation, that also can lead to ectopic pregnancy, tubal pregnancy, okay. Now, coming to tubal surgery, I think this is very easy for you. You will understand tubal surgery has already been written on top as a sterilization, but not that. They seem to be talking about other tubal surgeries like reconstructive surgery to improve fertility, right? So, reconstructive surgeries, or if there is some existing pathology, there is kinking of the tube, all these are contributing factors. Kinking means the same thing we told you, like this, right? Kinking of the tube, angulation of the tube. Okay, then coming to that you will write, then intrapelvic adhesions. So basically adhesions words you can understand, because of adhesion some pockets etc. can be there. So it's all stuck here and there, adhesion. So the oocyte also will go and nicely find a nice place there. Okay. ART, what is ART? Assisted reproductive technique, isn't it? So basically if you're having an IVF or a gift, that is a gamete intrafallopian tube transfer. So you are introducing something into the fallopian tube. So what is GIFT? Gamete intrafallopian tube transfer. Gamete is the sperm. So the sperm is being introduced into the fallopian tube, right? So what will happen? It can result in ectopic pregnancy. That's the tubular pregnancy. IVF ET. Now what is IVF, ET? IVF I can understand, in vitro fertilization. What is ET? Embryo transfer, I'm guessing. So in vitro fertilization, then an embryo transfer. So this can again lead to ectopic. Okay. So whenever you have a spontaneous pregnancy, the chance of tubal pregnancy is less compared to all these interventions. That's why they're calling it as iatrogenic. So status check. Where are we, guys? What are we looking at? The causes of tubal pregnancy, you have finished till here. Now only others is left. Look here. So if this previous ectopic pregnancy they had, then what will happen? The tube is already suffered. Now the next oocyte also comes there. It will try to stay there, and because of all the inflammation, adhesion, things that are there, the cilia which are not beating, etc. Something is stopping the oocyte from coming forward down, I feel, okay. So then prior induced abortion significantly increases the risk. So these people had a abortion prior which was induced, okay. Then defects of the tube. So the tube itself is so long, elongated tube is there, or there's some diverticulum in that, some diverticuli, right? And accessory ostia, that means some opening, is it ostia? Accessory opening is there. Nice. Then coming to the next point here, guys, transperitoneal migration of the ovum. So transperitoneally it has migrated. Can you say trans? Peritoneal. Yeah, transperitoneal migration of the ovum. Contralateral presence of corpus luteum is noticed in tubal pregnancy. So what happens, what are they talking about in this case? See, the pregnancy is growing here, but what they are saying is, they notice the corpus luteum here. That means the oocyte has come from actually the opposite side fallopian tube, transperitoneally migrated. I wonder it entered like this, is it? How did it enter? Transperitoneally it has migrated. Okay, so contralateral presence of corpus luteum is noticed in tubal pregnancy in about 10% cases. So that's the transperitoneal migration of the ovum. I think it has a lot of energy, to go all around the world. Okay, so that is all about the ectopic pregnancy causes, the reasons. Why does ectopic pregnancy happen? Just for that we have spent this whole video. So hope you have understood why exactly ectopic pregnancy happens. Okay, so guys, so you should understand one thing, that ectopic pregnancy is unsafe. It is a life-threatening. It can become a life-threatening situation for the mother and obviously for the fetus. So how will a woman present with ectopic pregnancy? She will she can present with abdominal pain, amenorrhea, mainly whenever comes with amenorrhea, that is, she's missed her period, you're going to check for pregnancy and also rule out an ectopic, right? And vaginal bleeding can be there, very important. If she comes with amenorrhea of few days and vaginal bleeding, you have to rule out ectopic. Check for beta HCG, check if pregnancy was having a positive, whether she had a positive pregnancy test, and you have to rule out ectopic, okay. Then you will have to, how will you diagnose ectopic? Positive beta HCG. So either you will check in the blood or in the urine, then you will do an ultrasound to rule out that there is nothing in the uterine cavity as such. So that must be somewhere else, because of which the HCG is more, isn't it? So there is no intrauterine pregnancy or fluid in the pouch of Douglas or adnexal mass, is it? Laparoscopy, laprotomy is done for confirmation. Do they do this for everybody? Okay. Then coming to treatment, how will you treat ectopic pregnancy? It can be surgical or medical. Basically, there are a lot of details which we are not looking at. We're just looking at summary kind of a thing here. So basically, you can do a laparoscopy or a laprotomy to remove this ectopic pregnancy. A salpingotomy, that is a hole in the fallopian tube. Salpingectomy, remove the fallopian tube, etc., etc. There's so many things that you can do. But basically they are trying to decide based on this factor whether it has ruptured or whether it has not ruptured yet. What do you think here the situation is? It has not ruptured according to me, and it might rupture very soon. So whether it has ruptured or unruptured. Let us see unruptured first. If it is unruptured, you can just medically treat it with a methotrexate. Just give methotrexate, I'm guessing, directly at that place, right? So it will get absorbed. If it is ruptured, then you should immediately do resuscitation and laprotomy both simultaneously. So somebody will be doing the resuscitation, that is the airway, breathing management, etc. And laprotomy, somebody else will be doing simultaneous resuscitation and laprotomy. And do not do first you try to don't try to do resuscitation followed by laprotomy. Both should be done simultaneously. This is if it has a ruptured, life-threatening situation, isn't it? So this is just a summary, but there are a lot of details that you have to know. In this video, we only covered why does ectopic pregnancy happen at all. So in this video, we wanted to look at the causes of ectopic pregnancy, just the causes. Why does it happen, right? So basically, we have looked at why there is a rising incidence of ectopic pregnancy because of incidence of infections are increasing, infertility procedures are increasing, right, and tubal surgeries are increasing because of lot of development of medical sciences, and also there is early detection. Earlier we could not detect, so we are not detecting early, but now we are detecting early. So as such, the ectopic pregnancies incidence seems to be rising, isn't it? So basically in the ectopic pregnancies, the most common is the tubal pregnancy. So why in the tube does it implant? Because that is the pathway of the oocyte that you have understood. Other than that, you should know that there can be inflammation of the tube, that is salpingitis, pelvic inflammatory disease, especially because of chlamydia trachomatis infection. So what will happen if there is infection, or inflammation, there can be loss of cilia, which is supposed to beat and push this oocyte towards the uterus. So there's loss of cilia, or the lumen of this tube is narrow, or there are some adhesions, so there'll be some pockets in which this oocyte can go and develop. Looks like tube is not so straight, so it is kinked, and angulations are there. Iatrogenic means some procedure was done by the doctor, isn't it? So there could be contraception failure. You got an intrauterine contraceptive device, example of progesta. There is chance that with the IUCD the person becomes pregnant. That time it can become a tubal pregnancy. Sterilization operation failure. So this person especially had a laparoscopic bipolar coagulation. So because of this sterilization failure, they can have a tubal pregnancy. Are you focusing, guys? So or they are using progestin only pill. If they are using progestin only pill or a post coital estrogen preparation, usually a post coital we give progesterone, isn't it? If they are giving a estrogen preparation, or if they are using instead of a combined oral contraceptive pill, that is even before they get pregnant, if they are using only progestin only pill, then there can be impaired tubal motility leading to tubal pregnancy. Tubal surgeries they've had, if they had tuboplasty, reconstructive surgeries, intrapelvic adhesion. So any adhesion, you can understand sticky things here and there. ART, what do you mean by adhesions? You understood, right? One tissue stuck to the other kind of a thing is an adhesion. Okay. ART means assisted reproductive techniques like GIFT, gamete intrafallopian transfer. Where are you transferring the gamete, that is the sperm, into the fallopian tube? You are only transferring. Or you are having an IVF treatment, that is you are having an in vitro fertilization with an embryo transfer. So basically infertility treatments. Then if you have had a previous ectopic pregnancy, there is a chance that you will have ectopic again, right? There's a 10 to 15% chances of repeat ectopic. Prior induced abortion, that means prior to this pregnancy you had a abortion, induced abortion. Then development defects of the tube itself is long, or diverticulum is there in that's some kind of a deviation, or there is an accessory ostium, that is an opening which is an accessory opening, extra opening kind of a thing. Ostia means what? You know, this is ostia. See, this is the opening, right, of this hole from the uterus to the tube, ostia. So accessory opening looks like. Or there is a transperitoneal migration of the ovum, that is it has actually, the oocyte has originated here, but what it has done is it got fertilized, then it migrated all the way and went to the other side and implanted. Transperitoneal migration of the ovum, because what happens, they have found the ectopic on this side, but the corpus luteum they have found on this side. So that is why they think that it is possible that this fertilized ovum went all around the world and implanted on the other side, right? So why does it happen in the tube? Like there is early degeneration of the zona pellucida, because of which there is some early trophoblastic activity. There is increased deciduar reaction, that is the pregnant endometrium, right? Tubal endometriosis means the endometrial tissue is present outside the uterus in the tube. Okay. So guys, I hope you understood the causes of tubal pregnancy, that is ectopic pregnancy. About prevention of ectopic pregnancy we will talk in the next video. Okay, bye bye.